We just played a headline earlier of Joe Biden talking about why Medicare for all would not have been a solution to the current problem. If there was a single payer system with some rationale or planning to a process of responding to an epidemic like this, would the situation have been easier to deal with?
Absolutely. There's no doubt. And I just want to explain a couple reasons why. Number one, the idea that 10% of your population doesn't have health care at all, or another 50% on top of that have a deductible that's so high that they've learned to ignore symptoms like a fever and a dry cough, which, by the way, are the symptoms of COVID-19, because they know that if they do go and seek medical care for those symptoms, that they'll be hit with a bill on the back end. That's a really dangerous state of affairs when you've got an incoming global pandemic. But even beyond that, I just want you to think about the structure of our health system. Hospitals make money in this system on elective surgeries. That's how they get reimbursed from insurance companies. But if you've got a global pandemic that's about to hit your hospital, what's the first thing you cancel? Elective surgeries. And so now you've got hospitals that not only are trying to staff up and be ready for one of the most serious public health crises of our time, but they're also battling bankruptcy on the back end because they've lost their main source of pay. All of that is because the system is run for profit. Here's the other part. We keep hearing about doctors going without PPE, personal protective equipment. And part of the reason why is because I've talked to business consultants who told them that the best way to supply your hospital is what we call just-in-time supplying, meaning you don't want to have a bunch of stuff laying around because you don't know when you're going to use it. That's all overhead you can strip away. But here's the problem. Well, when you're hit with a pandemic, just in time doesn't work because all of a sudden everybody's trying to get the resources that they need. Just in time is a classic page out of a business consulting manual. When you run hospitals like a business, you forget the fact that they're actually supposed to be there to save lives. And the third point is this. There is no incentive for prevention in our system. Why? Because our system makes money on people getting sick, right? You can't actually bill something if somebody does not get sick so that you can bill them for the care. And so if you look at just the way the system is set up, there's very little incentive to talk about prevention. And that's why we keep seeing budgets get cut for institutions like the CDC or local health departments or state health departments, because it just doesn't fit within the incentive structure of our health system. Imagine we had a system that actually rewarded keeping people healthy rather than taking care of them after they get sick. That's what Medicare for All would have done. We have a responsibility to learn from this moment and realize that we've got to guarantee everybody in this country health care. And if we don't, we will continue to be vulnerable to these kinds of massive public health crises.